So supplements for osteoporosis are a huge business with numerous options out there. Between our YouTube channel, Osteo Collective community, and patients, we probably direct over 10 million in supplement sales a year to different companies that I don't own and I have no financial interest in, to be clear. But today I want to review our top 5 supplements for osteoporosis in 2025. Everyone's supplement stack is customized, but there are some clear commonalities that we can discuss that you may be interested in. Before I get to my 5, what are your favorite supplements? Leave them in the comments on YouTube, and we'd love to take a look and see what you guys are taking. Okay, so first, before we get to the products and the data, let me just address financial bias here, because I think this is something that really is important when it comes to people talking about products on YouTube and social media to understand what the financial bias may be. I'm going to talk about 2 different companies here, and I have an affiliate relationship with both of them, but neither of them pays me to talk about their products. So this is not sponsored. This is simply me bringing forward the best products that I can to you, the audience, and then having an affiliate relationship with the company so that we can generate some revenue to help support the channel. Now, there is no bias here because all companies, all supplement companies have these relationships with people that are willing to talk about their products. Last year on this channel alone, we had over 3.5 million views. So you can imagine that I've been contacted by probably every supplement company who sells a product to those concerned about bone health. We pick our affiliates very carefully, and our goal is to protect you from people who are trying to sell products that do not have enough evidence to support their use. We have multiple videos like that. And lastly, if a company did have a great product that had great research behind it, I would absolutely bring it forward to you, because I do that in other videos where we do not have an affiliate relationship with the companies that sell the products that we're talking about. So please know that this comes from an unbiased perspective, but yes, I have an affiliate relationship with both of the companies that I'm about to mention. Okay, so let's talk about calcium. So calcium is feared. Calcium is controversial, but yet every doctor that you see when you get a diagnosis of osteoporosis will tell you to consume calcium. So you guys are kind of stuck. But here's the thing. We need to look at the research behind why calcium is feared and then figure out how to move forward, whether you need it or not. So if you go to this first study that was very popularized by the media from Boland, they showed that there's a 30% increased risk of heart attack with calcium supplementation. That's a big number. So a 30% increase in heart attack is a big deal. And clearly, if it were true, we would want to avoid calcium consumption as a result of that. But if you look at this study, this was calcium alone. There was no vitamin D included, and this was in a vitamin D deficient population by default. So he did continue to publish on this topic, and I won't go through all the details, but basically continue to publish and identify the same thing. So do we not use calcium? Well, you guys know that we do. So if you look at the alternative side of that, there was a follow-up study by Dr. Heaney. Now, Dr. Heaney essentially called Boland out for poor research practice, being biased, and basically said that we shouldn't believe any of his studies. I think that probably the truth is somewhere in between. I'll show you what I mean by that. So when you're seeing 2 people who are well respected in their fields who are saying opposite things, it becomes really difficult to know who to believe. Fortunately, we now have much more data because these were, 10 to 20 years ago. So if you look at some of the more recent data, so this third study I have here is a 2015 meta-analysis of randomized controlled trials. And this was on 63,000 postmenopausal women. So yeah, this is our population of interest, right? So 63,000 postmenopausal women, they were either taking calcium alone or calcium and vitamin D. And there was no impact on the supplementation on heart attack, heart disease, the other types of heart attack, and there was no significant change. However, there was a trend with calcium alone. So again, that signal kind of pops up. This fourth study I have here is known as the MESA study. This is a massive study that looked at cardiovascular risk. And again, you see the relative risk increase just slightly with supplementation from calcium. However, what's great about this study is it shows that if you get your calcium from food, so divide all the people up into quintiles, those that had the highest calcium intake from food had the lowest heart disease and heart attack. So there's a difference here between calcium supplementation and calcium from whole food sources. And this is really important. This fifth study I have here is a 2021 review, and it gets into kind of some of the details around calcium and vitamin D. And it basically just drives home the fact that, look, calcium on its own might be devious. We don't really know. The studies aren't clear, but we can eliminate that risk if we just add just a smidge of vitamin D. Your body's going to have a better idea of what to do with that calcium. So what's the takeaway then? Well, I think calcium alone does probably present some risk, but there's no reason why you should take a big chunk of calcium carbonate alone. In fact, the studies by Boland used only calcium carbonate and citrate. So there's clearly better forms. We can consider what a whole food source is, and then we can combine it with optimal nutrients to help with absorption and utilization. So this is where product choice becomes absolutely critical. Okay, so there are basically two then whole food forms of calcium. So one is MCHC, or microcrystalline hydroxyapatite complex, and the other is algae. So MCHC is from ground up bones, or it can actually be synthesized in a lab as well. If it comes from bones, it can contain natural proteins that can be anabolic and can help build bone. If it's from a lab, it's just calcium in that form. So is this better than calcium carbonate and citrate? Sure. The research supports that the minimally processed version will help improve bone mineral density, but my concern around MCHC is that there's a lot of mystery here because we generally don't know where the animals came from. We don't know what those bones were exposed to. We don't know anything about what those animals ate. And whatever they ate, whatever they were exposed to is going to be concentrated in their bones. And then if it's a synthesized product, then it's not going to have the other proteins that we want in it. So is it the best? It could be, but I don't think there's enough evidence to say that it is. So right now, I say the best is algae. Now, this might sound strange coming from me, but it's not that it's the best because of the alkalinity. It's not best because it's plant-based or because it's vegan. It's best because we can grow it in a controlled environment, we can test it for purity, and we have evidence to suggest that there's benefit when taken with other very specific nutrients on humans. So if you look at some of this evidence, you can see that compared to calcium citrate and carbonate, when you consume calcium from algae, you see alk-phos change in a positive way. You see calcium being laid down in a different way. You see hydrogen peroxide and oxidative stress reduced. So there's benefits in algae forms of calcium that you don't see anywhere else. Now, does everyone need calcium? Probably not. If you're going to consume calcium, though, if you consume it from a whole food source, I think we can escape the risk associated with calcium intake. So this is why I like the product AlgaeCal Plus. So this is the first product we're going to talk about today. So AlgaeCal Plus has 720 milligrams of calcium from a very specific algae, grown in a very specific way in a very specific place. It has 350 milligrams of magnesium, 1600 IU of D3, 100 micrograms of K2 as MK7 in all trans form. So that could be as much as 200 micrograms of a non-specific form. 3 milligrams of boron, 50 milligrams of vitamin C, and then micronutrients from the algae itself. Now, those micronutrients do include strontium. This is an important point here. This is not the therapeutic dose of strontium that you would get from their other strontium products from AlgaeCal. This is the amount of strontium that you would get if you were to grow algae from the earth, because strontium is a micronutrient in the earth. So that gets confusing for people. So this combination of things is a nice way to combine all of the things that I just mentioned, the K2, the boron, the vitamin C. If we don't consume a product like this, then we have to break apart all of these different ingredients, and you can end up with a whole lot more capsules and fillers to try to get all the things, same things that you're going to get from one, technically 4 capsules of this product. So then I look at AlgaeCal Plus as essentially a multi-mineral that's high in calcium with other critical bone nutrients included. Now, what's powerful about AlgaeCal as a company is that when they came out with their product, they didn't just bring it to market and say, look, we've got this calcium, we're going to help you build bone. They actually did human studies. And I did a whole video on this last year, so I'm not going to go in great depth here, but they did 3 separate studies. And the first study included a higher dose of strontium in both of the groups. So all we can say about this is that this product with strontium increased bone mineral density. It's not that surprising, but what is interesting is when people do blame big increases in bone mineral density on strontium, you can see here that actually the increases weren't that great. They also do some interesting things in these studies that I understand and I've been critical about in the past. Basically, what they're trying to do is to use less people over a shorter period of time to show as great an impact as possible. So they do some things like mean annualized percentage, meaning like they only did it for 6 months, but they take the data out to 12 months. They have expected loss rather than a control group. So, there are things that I would change about these studies, but at least they are studies done on humans on the product of interest. So I give them kudos for that. So the most interesting study is this 7th study that I have here. This was done in 2011. And there were 3 groups and 2 of them had strontium in it. But the one that really stuck out to me the most is the version, it's an older version of AlgaeCal Plus, but this older version of AlgaeCal Plus that did not have strontium in it. Now, again, one of the challenges with these publications is that in this publication, the graph was actually put in the publication incorrectly. And so when I first read this, I thought, man, this doesn't make any sense to me. Like the one without strontium outperformed the other 2 with strontium. But what happened is that they reversed 2 of the groups. And so once you understand that, then you can see that the 2 groups with strontium in it did outperform from a bone mineral density perspective. But the AlgaeCal Plus alone did improve bone mineral density over a mean annualized 12 months compared to expected losses and to baseline. So this is kind of unheard of from a vitamin D and calcium product, and it's because of all the other nutrients in there. But again, you're getting it all together in one place. And then they went on to do a follow-up study, and this is a 7-year follow-up study where those that were willing to participate continued to get imaging studies, and you saw a 1% increase continuously per year. So in theory, the product will continue to improve bone mineral density over time. It's not just a 1-year or 2-year thing. This study is not perfect either because this is a subgroup of people who were willing to participate in the study. So obviously there's going to be bias here somewhere, selection bias, because these are people who were active, they were engaged, doing other things. Who knows? So not great control here, but it does show that likely you're going to continue to see improvement. We just don't know how much if you were to do this in a large population in a well-controlled environment. So then when we came out with these recommendations to take AlgaeCal, we had some feedback of people that are concerned about safety and quality. And so I've talked with the company at length about this, and the statement from the company is that all of the minerals, including lead levels, are going to fluctuate up and down a little bit, just like they do in the earth. This is where we grow algae. All of the samples that are tested will have the safety thresholds that are set by different associations, and the levels are always going to be under these safety thresholds that are set. So this is growing in the world. It's not grown in a lab. So you're going to have contaminants in the soil that are going to show up in the algae. It's also considered organic. So, they're not spraying it with stuff that they're concentrating and giving you in a capsule. So again, controlled environment. They're grown in the best way possible, and then they are spot checked for purity. And anytime they do that, there's never been a batch that has been outside of the safety thresholds that are set by the government organizations that are looking at this. Okay, so I've got some more supplements to talk about. I'm not just going to sit here and talk about AlgaeCal Plus, but I wanted to get all of the research into that one because we get the most questions about it. And let's face it, there's actually the most competition for this product. But I get frustrated when I see people taking the combination bone health products that I don't think are doing them any good. So that's why I continue to push this product, because I want people to get the thing that's going to have the things in it that they need. So before I get to the rest of these, if you are struggling to put together your own supplement stack or exercise program, or you're just interested in like other people's experience of the challenges that they've gone through, please come join our masterclass. We have a masterclass that we do about every other week. I run it myself. We talk about the most common myths and misconceptions around bone health and osteoporosis reversal, and we save about 15 to 20 minutes for Q&A. So if you're interested in that, sign up. You can find the link in the description on YouTube. Okay, so our second product or products here are going to be fat-soluble vitamins. So I think it's hard to get enough fat-soluble vitamins through diet. Vitamin D, vitamin A, vitamin E, vitamin K. These are all necessary for optimal mineral balance and a whole lot more. I'm not going to go into depth on the research here, otherwise we would be here forever. But I have videos on each of these sub-ingredients elsewhere on our channel. So 2 products to consider here. So number 1 is from AlgaeCal, their D3 Complete. Another option to consider is Healthgevity Protect Plus. And I'm going to compare and contrast these a little bit. So each one of them, both of them, has cholecalciferol, which is vitamin D3. Vitamin K2 is MK7, same all trans, same product actually. Delta Gold, which is D-gamma tocopherols and mixed tocotrienols, and retinol. So it has the 4 forms that I want to see in a fat-soluble vitamin. The differences are that in the Protect 5, you're going to see significantly higher doses than you're going to see in the AlgaeCal Plus. AlgaeCal Plus also has K2 as MK4 as well as K1, whereas the Protect Plus only has K2 as MK7. The reason why we might choose one over the other is that the Protect Plus is going to have 5,000 IU of vitamin D, and that can drive people up pretty high, especially with the quality of the product. So if someone is especially vitamin D deficient, then we might use that product initially. It has quite a bit more of the other 3 fat-soluble vitamins as well, but the ideal range of the A, E, and K is a little bit of an unknown. So I can't say that the AlgaeCal is deficient or that the Protect Plus is too much. There just isn't enough data to say what the best dose of those fat-soluble vitamins is. So we use them both. We just use them both for different people for different reasons. All right, so number 3 is lactoferrin. So lactoferrin is interesting because it's a naturally occurring protein found in most mammal milks, including humans. If you look at the first breast milk that comes out after a baby is born, that colostrum milk, it is particularly abundant in colostrum, and that's not a coincidence because lactoferrin has a lot of properties that might be beneficial for both young babies, but also potentially as a tool for adults. So lactoferrin, again, present in almost all mammal milks, but it's more commonly seen in cow, goat, and sheep. But you have to be careful because if you're getting pasteurized products, it's not going to have any lactoferrin in it. The protein is it's not unstable, but it's unstable at heat and it gets denatured in the process of pasteurization. So the potential benefits of lactoferrin is that it's thought to be antibacterial, antiviral, helps regulate iron absorption and metabolism of iron. It is potentially anti-inflammatory. It can improve immune function. It can improve gut function. So the list kind of goes on and on and on for lactoferrin. And we have seen it work for people in all kinds of different scenarios. If you look at the studies on lactoferrin and bone health, you can see that lactoferrin as a supplement is independently shown to improve bone mineral density, specifically in postmenopausal women. I've got 2 studies here, so studies 8, study 9. Both of these studies showed a benefit. Now, this was kind of a unique form of lactoferrin, so I would like to see some additional research to say that this would be true with any lactoferrin because the form that they were using in these studies isn't available. But we do recommend this because of all the other potential benefits that come from lactoferrin. And if you think about the potential reason why lactoferrin could benefit bone health, I just said it's good for the immune system. It reduces oxidative stress. It's good for iron metabolism, which is how it reduces oxidative stress. So all of those things are going to help improve bone health. But the products I'm going to bring to you today, because the other lactoferrin products are out there, they're available. But the product I'm going to bring to you today is a new one. So this one really caught my eye recently because it's a human equivalent lactoferrin. So this is what would be found in breast milk or colostrum. Now, one of the challenges with lactoferrin is that we do find that people that are very intolerant to dairy can't take lactoferrin. So this is a way that we could get around that. So this product is called Immune Reboot. This is another product by HealthGevity. And there is data here to support, again, that this type of lactoferrin is going to optimize iron levels. It's going to reduce oxidative stress. It's going to enhance immune function. It's going to promote gut and microbiome health, and it's going to support the inflammatory balance. So this is a newer version, a way to get away from consuming it from other animals, and has some other cool stuff within this product. So just a really cool new product. I love bringing these out to the audience because I love seeing new products, people that are really pushing boundaries, and HealthGevity certainly does that. Number 4 here is collagen. So collagen, we've talked about, I have a whole specific video on collagen. But collagen, if you're not familiar with it, it's a protein that plays a crucial role in maintaining structure and function of various tissues in the body, including bone. It is not technically an essential thing. Like, we do actually make collagen, but production of collagen declines as we age. Interestingly, though, collagen is the most abundant protein in the body, so we definitely need it. Now, when it comes to collagen and bone health, there's really only one product on the market that has evidence to support the fact that it can improve bone mineral density, and that product is called Fortibone. So Fortibone is made by the company Gelita. They're out of Germany, and they funded studies to demonstrate that Fortibone could improve bone mineral density as an independent intervention. So this is cool, except that Fortibone is kind of its own special peptide product, and it's not the same as other collagens. So do other collagens do the same thing? I don't know. I don't know how different they are. But I've not seen a study on collagen supplementation outside of this that shows improvement in bone mineral density. So what are you going to do? The products that use Fortibone often use other types of collagen and kind of wrap them all together. So the AlgaeCal Collagen Complete does that. So you've got Forta Bone, and then you've got Forta Gel, which is for joint support. You've got Verisol, which is really popular for skin health. They talk about elasticity and increases in how you perceive your skin. And then UC2, which is a type 2 collagen, which is also good for joint health. And there are some other products out there, but what I find is that if we can limit the number of places that we order from, generally going to get some savings when you start combining these things, but also it just gets more convenient, easier to stay on things. All right, number 5, creatine. I love creatine personally. I love it for my patients. We don't always add it to patient supplement stacks because sometimes it can just be overwhelming. But I wanted to bring creatine back up here because creatine is a powder. It is one of the most well-studied supplements on the market. And there's this new product I wanted to bring forward. So Healthgevity, again, always trying to push the boundaries on things and bring things to market in a unique way. So this product is called Prime Strength, and it's going to combine creatine with some additional things with the mindset of enhancing muscle growth, speed up recovery, support healthy aging, and really just like, let's take all the things that are similar to creatine, put them in one place so you don't have to like have 5 different products. So the first ingredient here is called PeptiStrong. Now, PeptiStrong has been shown in studies to increase mTOR activation. So going after the actual cellular mechanism that induces muscle protein synthesis. It's been shown to reduce muscle loss by downregulating these atrophy-related genes and inflammation markers like TNF-alpha. It does a whole bunch of other potentially cool things through AMPK activation and NAD, which is a energy molecule enhancement. So this is a newer thing that I've seen them put in other products as well. It, of course, has creatine. It has creatine at the 5-gram mark, which is what most people are going for. Some people don't tolerate 5 grams, especially some smaller women. So you could use less than a full scoop of this, and you would just kind of cut that down based off of how much you wanted to take. This has a great dose of leucine in it. Leucine is the branched chain amino acid that is known to stimulate muscle protein synthesis. Again, it goes after the mTOR pathway. It just literally activates that pathway specifically. So glutamine is in here. Glutamine is good for your gut. It's good for muscle recovery. So lots of benefit there. And then taurine. Now, so taurine's interesting because we use it for a couple of different things, but I love the dose in here. So taurine can help from a neurologic perspective. It can help from a muscle recovery perspective. It can bring down homocysteine. It reduces oxidative stress. Taurine has a ton of potential benefits. One of my providers, Chelsea Hudson, really loves taurine. She wants to give it to everybody. So it's in here, again, in a great dose, because when you use a powder, you can put a lot of stuff in one place. So that's why I love this product, Prime Strength, because it combines good doses of creatine in addition to taurine and all the other stuff I just mentioned. So why not hit all these levers in one scoop rather than, trying to find 5 different powders and, I don't even have a place in my cabinet for that. So, all right, I think we're done. That was 5 supplements to optimize your bone health in 2025. So if you like this video, you might want to consider some of the individual videos that I talked about. So like this one on collagen, or this one is the full video on calcium that we did last year. And remember that osteoporosis isn't the end, but deciding to reverse it is a beginning. I'll see you in the next video.